Hello caterpillars, and shout outs to my new subscribers. Let's keep going. If this is your first time here, welcome, and if you are a returning subscriber, welcome back. If you found value in this content and you've not yet subscribed, please consider subscribing, liking, and sharing this video. As always, the information in this video is intended for educational purposes. It is not intended to diagnose or treat any diseases. Please speak with your healthcare provider before making any changes to your lifestyle. Let's discuss what we've covered so far during this series. In part 1, we discussed what is the menstrual cycle and the important hormones associated with the cycle. In part 2, we discussed how the hormones work together, leading up to ovulation, and the 3 fertility signs that occur during the first half of the cycle, specifically cervical mucus changes. In part 3, we discussed the 4 different cervical mucus changes that occur during the first half of the cycle and how those changes support fertility. If you have not yet seen those videos, I recommend you check them out. In part 4, we'll be discussing the hormonal changes that occur during the second half of the cycle, leading up to your period if pregnancy isn't achieved, and some of the problems that occur during the second half of the cycle, specifically PMS. If that's something you're interested in learning more about, please keep watching. Let's orient ourselves once again to this graph. In the first half of the cycle, we looked at the changes in the hormones, and we saw that just before ovulation, there's a surge in estrogen, LH, and a smaller surge in FSH, causing the egg to get released. We also noticed that basal body temperature remained consistent for the most part during the first half of the cycle. Before we move on, let's take a look at progesterone, the black line. Do you notice that it's pretty much non-existent during the first half of the cycle? Do you know why? Well, if you said it's because the corpus luteum has not yet formed, you would be correct. After ovulation, estrogen in the early part of the luteal phase declines slightly after its peak during the first half of the cycle. However, estrogen remains elevated and helps to maintain the uterine lining in preparation for the implantation of a fertilized egg. Estrogen also supports the development of the corpus luteum, which is formed from the ovarian follicle after ovulation. The corpus luteum begins to produce progesterone, which is the dominant hormone during the luteal phase. Progesterone helps to maintain the thickened uterine lining, making it more receptive to an embryo should you become pregnant. Progesterone levels continue to rise throughout the luteal phase, reaching their peak around days 7 to 10 after ovulation. FSH and LH are low during this phase. Once ovulation occurs, basal body temperature rises. Do you remember that progesterone is the heat-producing hormone? If fertilization does not occur, the corpus luteum begins to degenerate towards the end of the luteal phase, and as a result, progesterone and estrogen levels decline, leading to the shedding of the endometrium and the start of your period. Luteal phase defects. The luteal phase typically ranges from 10 to 16 days, with an average duration of around 14 days. Remember, it's the timing of ovulation that plays a crucial role in determining the length of the menstrual cycle, as ovulation occurs roughly 14 days before the start of your next period. The luteal phase is often referred to as the progesterone dominant phase of the menstrual cycle, and this is because progesterone levels is notably higher compared to estrogen levels during this time. One common issue that can arise during the luteal phase is known as estrogen dominance. So let's clarify what that is. Estrogen dominance typically occurs in the second half of the cycle when progesterone should be the dominant hormone in the phase. It's important to note that estrogen dominance does not mean that you have excessive levels of estrogen. Instead, it is the comparison of progesterone to estrogen levels. This imbalance can result from various factors, including your body's overproduction of estrogen or changes in estrogen metabolism or excretion, meaning your body's ability to detoxify estrogen. And if that's a topic you're interested in, leave a comment below and I'll create a video on estrogen detoxification. In essence, it's all about the ratio between progesterone to estrogen during the luteal phase of the cycle. So you may be saying, I have normal levels of estrogen. Well, even if you have normal levels of estrogen, if your progesterone is insufficient During this time, you can still experience symptoms of estrogen dominance. Now let's take a closer look at what those signs and symptoms could be of hormonal imbalances. There are many issues that can occur during the luteal phase, but for our purposes, we are going to focus on PMS. PMS, premenstrual syndrome, which is the mood swings and physiological discomfort that can arise during this phase. Recognizing these symptoms and seeking medical advice is crucial for addressing any luteal phase defects and managing the associated fertility issues that can arise. Let's look closer at PMS. If you're trying to determine whether you're experiencing PMS, one helpful question to ask yourself is whether your symptoms alleviate or disappear once your period begins. This can be a strong indicator of PMS, as PMS symptoms tend to improve or go away once menstruation begins. So what is PMS? So PMS is a group of symptoms that occur in a woman during the menstrual cycle due to an imbalance between estrogen and progesterone levels, also known as estrogen dominance. When does it occur? The second half of the cycle, the luteal phase. How long does it last? Symptoms can last as long as 2 weeks or briefly as 1 day. Symptoms always occur prior to and disappear either immediately after you begin your period. What group is affected? Well, between ages 19 and 45, although it could happen as early as 13 when a young lady begins her cycle. What are the symptoms? There are 4 groups of symptoms that are commonly associated with PMS. So let's talk about those symptoms. Many women experience a range of physical and emotional symptoms during the luteal phase, collectively known as PMS syndrome or PMS. PMS is a collection of symptoms that typically arise in the days or weeks leading up to your period. While the specific symptoms and their severity can vary from person to person, they are often categorized into 4 commonly recognized groups. Let's discuss those groups. Beginning with PMSA, or the anxiety group. The anxiety group consists of individuals who have anxiety, mood swings, irritability, and nervousness. PMSC, or the cravings group. Individuals experience headaches, cravings of sweets, increased appetite, heart racing, fatigue, and dizziness. Followed by PMSH, the hydrous or water group. Individuals experience weight gain, swelling of the extremities, hands and feet. Maybe you have breast tenderness or abdominal pain. And last but certainly not least, we have PMSD, the depression group, where you have depression, you have bouts of crying, confusion, and insomnia. On a side note, guys, isn't this group D the worst? Often leaving you a raging basket case where everyone have to avoid you. So the next time your period is approaching and you turn into Godzilla, smile and say, "It's not me, it's my hormones. I'm in group D." And then you can send them this video, okay? So I hope these categories helped you to identify your group. If it did, leave us a comment below. We'd love to hear about it. And my question to you is, do you experience PMS? And what category do you fall into? Well, caterpillars, that's all I have for you today. If you found this information helpful, please consider liking, subscribing, and sharing this video with someone you care about. Let's discuss what we'll be reviewing next time. So in part 5 of the video, we'll be discussing how to manually calculate if you have an irregular cycle. Okay, so there are apps that can do that, but it's important if your cycle is irregular to be able to identify how to calculate when you ovulate, particularly if you're trying to get pregnant. As always, my beautiful caterpillars, I'll see you where? At the edge of your comfort zone.